One thing I'd like you to expand on is the website itself and the number of contacts you get, but also your philosophy behind what you put on that website.
Well, I wanted to make it student-friendly. So almost all of the articles that I have published singly have been made available through the web, and now all of these are downloadable. So students, when they become interested in using comfort theory or they have an assignment, they can just download all of the primary sources. So it was the intention was to make it appeal to the students and help them with their homework, really. Because I figured then they would be more likely to sign up to find out about comfort theory in their courses. That was the philosophy. I also always had my email address on my website so that they could email me directly and ask me questions. And when they would ask questions that were asked by previous students, I put those questions into the frequently asked questions section. And now the website is so well developed that I can usually say to students, you'll find the answer to that in the frequently asked questions section or in my personal homepage if they want to know how the theory got started.
Okay.
And actually, one of the reasons we are updating the information today is because I would like to take advantage of new technologies where we can just make audio tapes out of these combination tapes now, so that students can download the audio portion onto their iPhones and or a CD and listen to this fascinating stuff in their car as they're commuting to school and back.
Because one of the things that I think you do very well, Kathy, is to share the information, and there are you don't have copyright rules that keep people from, that make it difficult to use your content.
Right. I've never asked for students to pay me for the use of their instruments, or practicing nurses. They can all get them for free on the website. And actually, legally, we can say that if it's on the internet, it's in the public domain.
I think that's one of the basic strengths of your approach, and that has really facilitated the dissemination of your theory, because it is so accessible, not only in content and information, but also in your approach to sharing. And I want to commend you on that.
I think with the increase in internet courses, distance learning, that comfort theory is well positioned to take advantage of new technologies that the students need to be successful in this type of learning environment.
Would be kind of interesting, wouldn't it, if it was developed as an independent course that they could take for credit?
Right, right.
Yeah.
We're going to work on something like that if there's an interest.
If there's an interest.
Right.
Excellent. Okay. Well, let's now talk about the expansion of the theory as it's progressed through research.
Okay. Much of the early research was done by you and me. We did intervention research with comfort as the outcome that we measured in patients. And as chronicled in the book and on the website, we used a number of different types of patient populations and research questions. But the outcome was always, did that intervention increase the patient's and or the family's comfort? That, I would say, was the test of the first part of the theory. That once comfort needs are identified, you build an intervention to address those needs, and then the intervention was effective if comfort is increased compared to the baseline where you started.
And what impact then that had on the subsequent outcomes?
Right, and that would be the second part of the theory. Is an increase in comfort correlated with doing better in health-seeking behaviors, engaging more fully, rehabilitating more thoroughly or quickly, healing from surgical wounds. T-cell formation would be an example of internal behaviors. These internal and external behaviors are deemed important for that target population and for the research subjects. It's what they value and what they want to see improve. And so that would be a test of the second part of the theory. Okay. And you and I did extend some of our findings in that direction, where we were able to show that people with higher comfort actually did do better, that it was a strong indicator. An increase in comfort was a strong indicator of how well they were going to do with the chosen health-seeking behaviors.